Good afternoon. My name is David BAYADA. I'm the CEO here at BAYADA Home Healthcare, and today is Wednesday, April 1st. This is our daily CEO update amidst this coronavirus pandemic. We're fortunate today to have two of our clinical experts here at BAYADA that have really helped us build expertise and competency around infection prevention over decades here at BAYADA. And all of those skills and areas of expertise are clearly the center of attention now as we, as an organization and as clinicians and as a community, navigate how best to adapt to the daily changing dynamics of the coronavirus crisis. And so I want to welcome Bridget McGovern and Susan Engel, the two clinical leaders on our infection prevention team, which at BAYADA is pretty unique. A lot of organizations don't have a dedicated infection prevention competency or team. And so it's something that we've always taken very seriously. And as I said, this is the time where they have center stage as we work to support you in the field with all the tools and education protocol necessary to safely and competently take care of our clients. So I want to just turn to Susan and Bridget and maybe just talk a little bit about what's different in some of the real-time decision-making and adaptation and adjustments you've had to make on a daily basis to support our employees and our clients during the crisis.
Hi, yes, I'm Susan Engel.
I'm Bridget McGovern.
So thank you for joining us today. So what's different is that this is new. So COVID-19 is brand new, and it's requiring a lot of efforts to determine what it is we need to do to keep both our clients and you safe. What we do have is a great foundation. So that foundation is all of the knowledge that we already have around good hand hygiene practices, standard precautions, transmission-based precautions. All that foundation knowledge you have for infection prevention practices is outlined in our Staying Healthy guides. And now what we're doing is the two of us are researching every single day to stay on top of things that are new related to COVID-19 and the practices that you need to implement to keep you safe. What's not new is airborne precautions, right, Bridget?
Right.
So airborne precautions have been around for a long time. It's just we at BAYADA have not had a lot of clients who've required that. So the change is figuring out how we get everybody comfortable with following those. And we're very confident with CDC's recommendations and guidelines like we've always been and we've always followed.
Right. And so part of what Susan and I have been pouring a lot of our time and energy into doing right now is really combing through those guidelines and, taking what's new from the CDC and combining that with all the standard practices that we already know are infection prevention best practices, like Susan mentioned, the hand hygiene, the respiratory etiquette. These are all things that we're educated on, at least on an annual basis right now. And so in evaluating the new guidelines, we use that information to push more resources and more education out to our clinical leadership so that you as the field employee can utilize your clinical managers and your directors when you do have questions about what do I do as my job pertains to caring for a client with COVID-19. Those are going to be your real point of contact for getting those questions answered because of the work that Susan and I have put into developing the resources and the tools to educate them and to give them the knowledge and to empower them and make them feel confident that they can answer any questions that you might have.
So we've actually built a portal that clinical leaders and directors can access all the information that we have in our brain from reading everything about this as tools. So decision trees and additional educational tools about goggles, wearing goggles and wearing N95 respirators, and the use of surgical masks versus comfort, non-PPE masks. And so we've developed just a plethora of information into a one-stop shopping, which is the source of truth for what is clinically evidence-based, as we've always done.
That's great.
So we're really working hard to make sure that you feel safe, and we are confident with the information that we're providing because of the research we're doing, that you are safe.
Yeah, I think that's a great point. You know, we talk a lot about the source of truth, right? And for Susan and I, our source of truth has always been the CDC guidelines and, you know, what they outline as best practices for healthcare workers overall. So we continue to utilize the CDC's guidelines around making sure healthcare workers are safe when caring for clients with COVID-19 as well.
And they've never failed me. I've been in home care for 35 years. So I've followed those, I've practiced those when HIV was new, AIDS was new, when we had the 2009 pandemic influenza, when we've had Ebola. They work. I have confidence in CDC. And so that's what we're depending on once again, because they've not ever let us down to develop what you need to keep you safe.
And I think you can feel confident in knowing that we utilize the CDC in making our decisions around what tools and resources need and what information needs to be pushed out to the offices.
That's great. Thanks, Susan and Bridget. We're grateful to have such expertise focused intently and dedicated to this crisis, supporting our field staff, our clients, and our clinical leaders to ensure we are able to deliver care in the safest way. If you're out there and you're not quite sure in a given situation what to do or what the expectation is or what the appropriate precautions are, work with your clinical manager, with your director. All the information that Susan and Bridget are developing and adapting in real time every day is being pushed through your clinical manager and your director so that you have what you need to deliver safe and competent care every single day during this period of crisis and ongoing. Thanks for being with us. We'll see you tomorrow.